Hey guys, Dr. Vic here at Flossophy Boutique. We're going to show you how to make a kind of like an impression for a duplicate denture. You can use this in your office to make a radiographic guide when you take a CT for implants in a patient that's edentulous. And you can also use this to make a duplicate denture out of acrylic same day, so you can take a custom you can make it a custom tray and take an impression and then use it as a wax rim. That saves the patient about 2 appointments, and that could be about a whole month that the patient gets their new dentures, and it keeps the office productive. Hey guys, I'm going to show you today how to make an implant stent using a denture. Traditionally, you can use implant cast, but I just have one of those denture cleaning cases that everybody has. And we're going to use some lab putty. You can also do some alginate, but let's do it with lab putty because maybe you don't have enough time and you just want to do this at the end of the day or do it throughout the day. Your assistant can do it, or of course the dentist can do it. What we want to do is do it in about 2 runs. So you're going to make a layer of lab putty on the bottom. You're going to Vaseline it and put a separating medium, place the denture, and then take a mold on top. And that way it'll create a cavity for acrylic. A lot of people used to use acrylic with a radio opaquer, and then you can show it on the CT machine. But traditionally I make an acrylic denture and then take a green mousse on the bottom, and then that'll show you the soft tissues. It'll be a reline for the patient, make sure the denture seats nice, and show the soft tissue when you take the CT with the denture in place. So we're going to duplicate this denture to make an implant stent. We're going to use lab putty here. If you have the time and you want to save on materials, you can use alginate. You're going to pour up the alginate with the denture and that'll create a cavity. And I'll show you how to make it. You're going to do it in about 2 layers. You're going to mix the lab putty first, and you're going to press in the denture. Make sure there's a separating medium. Place the top lab putty, and you want to make sure there's a lot of pressure, creating a seal. Because this is not metal, this is just plastic, so that when you cold press the acrylic, you can make a duplicate denture. So I got the denture here, and then you can either place it like this or like that. I'm going to place it with the teeth down. And then I got the lab putty measured out. Make sure you have enough, because it's going to require a lot here. And this is a lot better if it's a base and catalyst solid to mix, I've noticed. With the tube, it's a little bit cheaper, but you don't really know how much catalyst you're mixing, and if you don't put enough, it can take a really long time to mix. So the putty is thoroughly mixed. We're going to place it in the cavity here. And the trick is to get this halfway in, okay? I'm putting the teeth side down because I can place the lab putty in here more accurately and then press the top layer. But we're gonna push down, but we're not going to push all the way, because these retromolar pad areas, I want some lab putty right there. And then these borders, we're going to bring up. So let's push it a little bit more. And then make those retromolar pad areas. And then we're going to get rid of all the undercuts. Because if you have a nice seal, it's going to open a lot easier, and you can clean out the acrylic a lot easier and save your acrylic burn. So get rid of all the undercuts. So it would be a lot more helpful if I had a little bit more material. So instead of 4 scoops, guys, use 5. 5 or 6. Extra doesn't hurt anybody. So I had these undercuts, so I just mixed a little bit more, and then I'm gonna place it in the undercuts, because if you don't have a separating medium, the VPS will stick to the other lab putty. And make sure I work fast this time. I do talk a lot. So get all the undercuts and don't go into the denture. So it's gonna harden pretty quick, so you can actually just move on to the next step here. So this is the most important step. Since lab putty sticks to each other, you need a separating medium. You can use silicone or good old Vaseline. You don't want to do too much to the denture itself so you don't have air bubbles, but it does not hurt to put Vaseline. So my hands are tied, so I have my assistant mix here. Now you just have to cover the top. You don't need it to fill the whole box or anything. So use just enough lab putty. We're gonna close the case and put a couple books or put this on top, under a chair, and that'll be like a pressure. So you got a bunch here, work fast. You're gonna take a little bit and you're gonna put it inside the denture so there's no air bubbles. Even if there are air bubbles, you're going to reline the bottom so you can get rid of those real easily. That is just enough. So make sure you put something on top right here, like a little weight, so that this makes a perfect seal. Look at that. It's a lot better if this stays right here, but can I have a buckle? Whole thing out and just break the air seal, and there we go. Hey, look, it looks like a master cast. So this is very durable, and you can make multiple. Let's say the patient is here for new dentures. Take the old denture, and you can save 2 appointments by making this a custom tray and the wax rim. You can also make a duplicate denture. That's a little bit more complex. You definitely want to use lab putty for that. But this is going to be used for an implant stent guide. And we'll take this off. Look how easy that comes off. And then we have the teeth. So now we have a master cast and the teeth. And when we put acrylic on here, it'll create the denture. So you want to do it outside. You want to mix the acrylic, place it in there, do it outside, take the excess off, and then put it back in the case under pressure.